Hi everyone, this is Dr. Brian Castelein with Brighton Foot and Ankle, and in this video we're going to go over fracture terminology and what are some of the key words that we use as physicians to talk about fractures. Because you might be diagnosed with an oblique, comminuted, minimally displaced, extra-articular Jones fracture, and what the heck does that mean? Because that means a lot to me and it means a lot to my colleagues. But let's break down some of these terms. The first thing to talk about is displaced versus non-displaced fracture. A displaced fracture is where the fracture pieces are separated, where there is a gap in between them. And if there is a significant gap, that fracture might need to go to the operating room to put the two pieces back together to allow for healing. Non-displaced means that the fracture is together. There is no separation between the fracture. Extra-articular versus intra-articular means, does that fracture go into the joint? Intra-articular fractures, the fracture goes actually into the joint, and again, this is probably needing to go to the operating room to help stabilize that fracture, to put the joint into the best spot that we can to allow for healing and to slow down the progression of arthritis. Extra-articulars might not need to go to the operating room because these fractures go outside of the joint. Another topic that we talk about is a incomplete versus a complete fracture. Now this is very obvious, but a stress fracture is an incomplete fracture. That's where we have a crack in the bone that doesn't go all the way through the bone. There's no displacement, and that can usually be healed conservatively. When we talk about the orientation of our fracture, we talk about oblique, meaning being at an angle, versus transverse, which means directly across the fracture. Again, this makes a big difference in the stability of the fracture. We also like to talk about a simple fracture, meaning that's just in two pieces, versus a comminuted fracture. Comminuted fractures, I like to think of Humpty Dumpty and being in several different pieces and needing to put those pieces back together. Again, this is going to be steering us more towards the operating room where we need to restore the natural shape of the bone and put those pieces back into a better spot. Compound versus closed fracture. Compound means that the fracture is actually open and the bone has protruding out of the skin. This is very much a medical emergency and needs to go to the operating room to clean out that bone, to clean the skin, and to best prevent infection in the future. Closed fractures, the skin is surrounding the fracture, so we have less of an infection risk to the area. Another common term that you might hear is an avulsion fracture. An avulsion fracture is where the bone has failed, but the tendon or ligament that attaches into the bone is still doing really well, and that is nice and healthy for us. The last fracture that you might hear about happens in kids. This is called a green stick fracture. This is where the young, soft, rapidly growing bone kind of tears, kind of like a tree can kind of tear and lose a limb, as opposed to being broken in half like something that's a little bit older and more brittle. So these are some of the terms that we use in the foot and the ankle to help describe your fractures, to help understand what's happening. If you hear your doctor or our doctors here at Brighton Foot and Ankle talk about it, ask us, what do the terms mean and what does this mean for your healing? So that way we can get you into a better spot and get you back into your daily activities.